Hi everyone, my name is Diana Velasquez and this is my internship presentation. Where did I do my internship? I did my internship at the Central Animal Hospital in Leominster. Central Animal Hospital is a small animal clinic that primarily sees cats and dogs, but they do see pigs, birds, and rats every once in a while. Due to COVID, there has been some changes in the hospital and the internship itself. I was lucky enough to be able to get this internship, and I would like to thank my sister for that because she actually works at this clinic, and if it wasn't for her, I would not have gotten this internship in the hospital in the first place. In the hospital, they are seeing appointments differently than before. No one is allowed in the building other than the staff itself. In the case of a euthanasia, which there has been quite a bit of euthanasias this year, the owner has the choice to be with the pet or have the staff euthanize the pet in the hospital without them. If the owner chooses to be with the pet during the euthanasia, this is okay, but they have to be fully gowned and wearing a mask, and they have to comply with the policies in place to protect the staff and owners. In the case of a prescription pickup, people are still not allowed in the building, and we have a vestibule connected to the building that we are able to lock, and prescriptions out there for people who have already paid, and they can come in and pick it up themselves, but they do require a mask still. Right now for appointments, there's 2 appointment rooms that have windows that face the parking lot that owners can see their pet during the appointment and also speak to the doctor during the appointment. But they are required to wear a mask. For future plans, these 2 rooms are going to be under construction and making the windows into doors and having a vestibule connected to this part of the hospital. This will be good for cold winters where the pet owners will be able to comfortably be apart from the staff while also watching and asking questions. For this internship, I had 3 outcomes. My first outcome was laboratory skills. I needed to improve my lab skills in a clinical setting, including ear swabs, fecal samples, urine samples, and blood work. To be able to complete my first outcome, I would have to shadow an employee to be able to ask questions, see and learn how to go through the steps of completing the lab skills, and eventually be able to run the ear swabs, fecals, urine samples, and blood work alone. For my second outcome, I had to advance the knowledge of vaccines for both dogs and cats and learn proper terminology and procedure of vaccines. To complete my second outcome, I would have to ask questions about vaccinations and certain diseases that they prevent. I would learn the areas of vaccination, learn the differences of subcutaneous vaccine versus intramuscular vaccines, and I would watch a vaccination in progress, and if I was allowed, I would be able to give a vaccine myself. For my third outcome, I had to gain advanced knowledge in cardiology in cats and dogs. I had to learn about their heart diseases, defects, and treatments. To be able to complete my third outcome, I would have to learn about certain heart diseases, what they sound like, and what the causes are. I would have to listen to a heart murmur and learn the treatment. To be able to talk about my outcomes, I was able to complete them and learn as much as I could. I'm going to talk about the pets that came into the hospital, and most of them come with pictures, but I will be withholding their name to maintain anonymity. For lab work, I started out at the lab bench running a bunch of blood work. My manager wanted me to get the hang of the process first before continuing. I realized that most of the time we would do pre-surgical blood work for older animals undergoing anesthesia, and we would also do CBCs for sick animals along with blood chemistries. We did not do a lot of microscope work, but the couple of slides that we did do were really interesting. In the bottom left corner of my slide, you will see through the microscope a couple of purple dots. This was a dog that had high counts of white blood cells, and what the slide was presenting was a large amount of neutrophils, meaning that the dog was truly sick, and this is exactly what the doctor was looking for. In the top of my screen, another image of a microscope slide, you will see ear mites. This is really interesting because it was a quick ear swab that didn't look very infected and was not red or inflamed, but we decided to look under the microscope just in case anything were to come up. And because the owner said that the dog was presenting with itchy ears, so we took a swab and put it under the microscope, and it was really interesting because as soon as you looked into the microscope, you could see little tiny insects moving, and it looked like they were tiny ticks, but they were ear mites. To treat ear mites, the owners were given an anti-parasitic to put into the dog's ear for a period of time until the next recheck, and also an antibiotic in case of infection. I wanted to take my daily blood work step by step with you to let you know exactly what I was doing. So we can start with the animal, in this case, the cat that was going to get surgery and needed pre-surgical work. So we would get the blood. We had about 2 tubes, one with the red top and one with the purple, and those are specific for the type of blood work they were going to get. And we put it into the computer and get a little piece of paper that tells us exactly what we need to run the blood work. And then we would spin the blood in the centrifuge. Of course, we had to balance it. And after we would see that it's in the computer, click the name, put it through, and that we would go to the specific machine, and we need to do the same thing again. Click the name, put it through, and depending on which machine and what test you're running, you would need certain chemistries, lights, or just put the blood in as it is. I also wanted to show you what the blood work shows up as. So right here is actually one of the blood work that we ran, and I cropped it so that there's no name and no doctor connected to it. But as you can see, on the far right is a bar graph, and in the middle is where you want the little black line to be. If it's a little bit over to the left, it'll be blue, and that means that the readings were low. And if it's a little bit too much over to the right, it'll be red, and that means the reading was high. I also wanted to talk about when they do blood work. So specifically, they do blood work during your first visit, your annual visits, when the dog or cat is sick, during pre-surgical tests, especially for older animals. We also do it before putting the animal on new medications, and especially during senior wellness exams to make sure nothing has changed. Some common laboratory analysis that we do is urine analysis, which evaluates the dog or cat's urine to reveal hydration status, infections, kidney or bladder diseases, diabetes, and other health conditions. Fecal exams, which evaluates the animal's stool for color consistency and as well as presence of blood or mucus, can also examine for intestinal parasites, fungus, or protozoa. The CBC, which stands for Complete Blood Count, analyzes the animal's blood to assess features of the blood, including red and white cell count, immunity status, and the measure of hemoglobin, which is the actual substance in the red blood cells that carries oxygen. Blood clotting times test the animal for bleeding disorders, and blood chemistries identify the status of the animal's internal organs and also gauge his or her health before anesthetizing for surgery. Cytologies are collection of samples of sebum or cellular debris on the skin and in the ears to determine if an infection is present. In addition, they perform needle or cord biopsies of lumps or masses on an animal's body for cancer cells. For cardiology, most of the time it was low-grade heart murmurs that you could hear with the stethoscope. And as long as there is no symptoms of any heart disease, it was a low-grade murmur, they would leave it alone. And if it was a high-grade murmur, they would see where the issue is coming from and put on medication to hopefully correct the irregular heartbeats. I was lucky enough to be working when they did an ultrasound on a young golden retriever puppy that had heart problems that they did not know what it was yet. And it ended up being severe aortic stenosis. Aortic stenosis is very severe, and it is the narrowing of a valve in the large blood vessel branching off the heart, and the narrowing keeps the valve from opening fully, reducing blood flow to the body and making the heart work harder. In this case, the doctor said that usually dogs with this aortic stenosis, and how severe it is, last from 3 to 5 years of life, and there is surgery to correct it, but the corrections only lessen the symptoms and do not increase longevity. In this case, we would be worried about placement of the dog in the home, but luckily this dog belonged to 2 amazing doctors that were prepared to deal with a dog that had heart disease, and they said that they were going to keep him and not make him go through the surgery because the surgery would come with a lot of complications, and they were already nervous of putting a dog with aortic stenosis under anesthesia. So he will live out the rest of his life in a very amazing home. Symptoms of heart disease include coughing, breathing problems, arrhythmia, which is irregular heartbeat, arterial hypertension, and pulmonary hypertension. Treatments include medication that help correct irregular heartbeats, medications to slow fluid buildup in the lungs, surgery to correct torn valve or insert a pacemaker, and limit exercise and manage weight. Some diagnostic measures include systolic heart murmurs that can be heard with a stethoscope, can be graded by intensity of how loud it is from 1 to 6. A grade of 1 out of 6 is faint and heard only with a special effort, and a grade 6 out of 6 is extremely loud and can be heard with a stethoscope even when lightly removed from the chest. Other diagnostic procedures include echocardiography, Doppler echocardiography, radiography, which is x-rays, ECG, which are electrocardiography. They can also do laboratory blood tests and other specialized tests that can indicate presence and severity of heart disease. For vaccinations, I wanted to talk about the type of vaccines, why the owner should get them, and the puppy vaccine schedule and the kitten vaccine schedule. First, I'm going to talk about the type of vaccines. The first vaccines for dogs is Bordetella. This is a highly infectious bacterium that causes severe fits of coughing, vomiting, and in rare cases, seizures and death. It's the primary cause of kennel cough. Most of the dogs that come in with kennel cough have gotten it from daycare or boarding, hence why it's called kennel cough. It's spread through aerosol droplets. Next is canine parainfluenza. It's one of the several viruses that can contribute to kennel cough as well. The next vaccine is canine distemper. This is a vaccine that protects against a severe contagious disease caused by a virus that attacks the respiratory, gastrointestinal, and nervous system of dogs, raccoons, skunks, and other animals. Distemper spreads through airborne exposure, through sneezes or coughing from an infected animal. This virus can be transmitted and shared by food and water bowls and equipment. It usually causes discharge from the eyes or nose, fever, coughing, vomiting, diarrhea, seizures, twitching, paralysis, and often death. There is no cure for distemper, and the treatment consists of supportive care and efforts to prevent secondary infections and control of the symptoms such as vomiting and seizures. Canine hepatitis is an infectious and highly contagious viral infection that affects the liver, kidney, spleen, lungs, and the eyes of the affected dog. This disease of the liver is caused by a virus that is unrelated to the human form of hepatitis. The symptoms range from a slight fever and congestion to inflammation of the mucous membranes to vomiting, jaundice, stomach enlargement, and pain around the liver. Many dogs can overcome the mild form of the disease, but the severe form can kill. There is no cure, but doctors can treat the symptoms. Leptospirosis is unlike most diseases. Leptospirosis is caused by bacteria, and some dogs may show no symptoms at all. Leptospirosis can be found worldwide in soil and water. It's a zoonotic disease, meaning that it can be spread from animals to people. When symptoms do appear, they include fever, vomiting, abdominal pain, diarrhea, loss of appetite, severe weakness and lethargy, stiffness, jaundice, muscle pain, infertility, kidney failure, and antibiotics are effective, and the sooner they are given, the better. We actually had an Aussie mix come in completely down, but we had no idea why, and when we had run some blood tests, we found out that he indeed leptospirosis, and I actually took a picture of him because he was on leptospirosis warning watch because it's a zoonotic disease and we had to be extra careful handling him. Next disease that we have a vaccine for is Lyme disease. Lyme disease is an infection, tick-borne disease caused by a certain type of bacteria. It's transmitted via ticks, and infected dogs could start limping, his lymph nodes can swell, temperatures can rise, and they usually stop eating. This disease can affect the heart and joints, among other things, and lead to neurological disorders. Parvovirus is a highly contagious virus that affects all dogs, but unvaccinated dogs and puppies less than 4 months of age are at the most risk to contract it. This virus attacks the gastrointestinal system and creates a loss of appetite, vomiting, fever, and often severe bloody diarrhea. Extreme dehydration can rapidly kill a dog within 48 to 72 hours, so prompt veterinary attention is crucial. There is no cure, so keeping the dog hydrated and controlling the secondary symptoms can keep him going until his immune system beats the illness. Rabies is a viral disease of mammals that invades the central nervous system, causing headache, anxiety, hallucination, excessive drooling, paralysis, and death. It's most often transmitted through the bite of a rabid animal, and treatment within hours of infection is essential, otherwise, death is highly likely. Most states require rabies vaccination for both dogs and cats. Next, we will be going through the vaccines for kittens, which rabies is already one that we went over. FERCP is one, and it stands for feline viral rhinotracheitis, calicivirus, and panleukopenia. This is a core vaccine considered essential for all kittens. Calicivirus and viral rhinotracheitis are common feline viruses known to cause upper respiratory infections in cats. Panleukopenia, commonly referred to as feline distemper, is highly contagious and often a fatal disease that attacks rapidly growing and dividing cells like those in the intestines, bone marrow, and the developing fetus. FELV, or feline leukemia virus, is a vaccine that is considered non-core for cats. However, it's highly recommended for all kittens. And adult cats who will spend time outdoors should get this vaccine booster annually. Feline leukemia is one of the most common infectious diseases in cats, and it's spread most commonly through bite wounds or via prolonged close contact with an infected cat. This can cause a variety of health issues in cats, including cancer and immune system disorders. FIV stands for feline immunodeficiency virus. It's a common virus spread commonly by bite wounds. This vaccine is non-core, but recommended only for cats at a very high risk of exposure to FIV. Though many FIV positive cats can live normal lives, those adversely affected will suffer from various illnesses due to the immune system dysfunction. Now that we went through all the vaccines for dogs and cats, we'll talk about the puppy schedule and the kitten schedules. When talking about the puppy vaccine schedule, I'll be saying recommended vaccines and optional vaccines. By this, I mean recommended by doctors worldwide. When I say optional, I mean per the decision of the owner, but usually recommended by the doctor depending on lifestyle and location of living. For puppies at 6 to 8 weeks of age, the recommended vaccines are the distemper and parvovirus vaccines. Optional vaccines to start are Bordetella. At 10 to 12 weeks of life, the recommended vaccines are the DHPP, which is the distemper, adenovirus, parainfluenza, and parvovirus all in one vaccine. And the optional vaccines are the influenza, leptospirosis, Bordetella, and Lyme. At 16 to 18 weeks of life, the recommended vaccines are the DHPP, again as a booster, and the rabies vaccines to start, which is required by the law in Massachusetts. At 12 to 16 months of age, another DHPP vaccine, and if the rabies vaccine was not given, it can be done at this time as well. Optional vaccines at this time are leptospirosis, Bordetella, and Lyme disease vaccines. Every 1 to 2 years, the recommended vaccines are the DHPP, and the optional vaccines are the influenza, leptospirosis, Bordetella, and Lyme. Every 1 to 3 years, rabies is required by law. For kittens, at 6 to 8 weeks, the recommended vaccines are the FERCP, and the optional ones are the FELV and the FIV. At 9 to 11 weeks of age, FERCP boosters recommended, and the optional boosters are the FELV and FIV. At 12 to 14 weeks of age, the FERCP boosters given, and the FELV and FIV are optional. At 15 to 17 weeks of age, the FERCP has its final booster, and the rabies is required by law. In my miscellaneous section, I wanted to include all the things that were not included in my outcomes, but I still felt that were very interesting and I learned a lot from. I was able to witness an x-ray of a dog who ate earbuds and had to have it removed. I was able to sit in on a lot of surgeries, some of which were basic spay and neuters, others were mass removals and colectomies. I was able to witness a lot of abscess and sebaceous cyst removals, which were mostly just opened and drained and put a drain in, and later had the drain removed and sutured up. I also witnessed a lot of wound repairs from dogs hurting their tails, and I also witnessed a lot of yeast infections in the ears that were treated easily with some ear drops, but most of the dogs that had the yeast infections were frequent flyers that had them every year around the same time. I wanted to reflect on my time at the Central Animal Hospital because it was not my first time working at an animal hospital, but it was different in the sense that I felt more comfortable. I had my sister there, and I also knew the co-workers already from previous times of hanging outside of work. I realized that I'm pretty efficient at fast paced, especially when it comes to appointments, and it takes a lot for me to get frustrated. And I'm often calm in hectic situations. I also learned that there's a lot I do not know and I want to learn, especially when it comes to surgeries and research. And I learned to ask a lot of questions, and I was encouraged to ask a lot of questions, which I'm very appreciative of. I enjoy the clinical work, but I'm not sure if I will continue. I did get hired and I'm enjoying it while it lasts, but I'm not sure if I want to stay in the veterinary field. I do, however, really enjoy the research aspect, and so maybe I will pursue the research part of the clinical work. And last but not least, I made lifelong friends, and I have had a lot of experiences that will stay with me forever. And not just with me, but with my sister and my daughter as well. As you can see in the corner of the screen, she's holding some newborn puppies that were delivered from an emergency C-section that I had to go to after I picked her up from school. I had an amazing time in this internship, and I'm going to enjoy working here for a while. And hopefully, I've made a lot of connections with my coworkers that will last forever. I really enjoyed this internship, and I hope you enjoyed my presentation. Thank you.